what's the point of being snatched if you can't feel confident in the clothes that you want to wear or the swimsuits and bikinis that you want to wear, right? Welcome back to my YouTube channel. It's me, Dyme LaShawn, and we back at it again. If this is your first time here, welcome. Come on in and grab a seat. And if you already game, you already know what's what because you already know the vibes. Basically, this channel talks about pretty much everything bad bitch wellness. Yes, I'm coining the phrase bad bitch wellness. Basically, anything that has anything to do with women being the best versions of themselves, having the life that they want, and basically elevating the lifestyles that they already have. And lots of things fall under that: motherhood, plastic surgery, cosmetics, vlogging, story times, different things. You can always expect to get something from this channel that has anything to do with learning something, a lesson learned on my behalf that I want to share with you guys, or something that I've gathered so that it can make your life easier or more enjoyable in some way or form, even if it's just in the form of a laugh. So if you're interested in that, make sure you hit the subscribe button because you don't want to miss a thing over here. I promise this year things are going to get great, and when I mean this year, I'm already in 2022, baby. Okay, good. So today's video is going to be about lipo burns and faja burns, and the burns that you get from plastic surgery or wearing different garments after plastic surgery. I know that there's a lot of controversy on how you get them and different things like that, but I'm going to personally share with you guys my thoughts on it, what I've learned from different research, and a couple of ways that you can combat the scar after we go over that stuff. So first things first, I will say that I had a lipo burn. I had a lipo burn on my left flank. It was not cute, and I was really freaked out about it. From the research that I've done, you are more likely to get a lipo burn from a surgeon that is aggressive, a surgeon that is uneven, like uneven in his or her approach, and also if you don't already have that much fat there. But I do know a lot of people of color definitely get lipo burns, and our surgery results will be different from those who are not of the same racial background or ethnic background. You must go into surgery thinking that. Please do not pull up pictures of Kim K, show them to your surgeon, and when you come out of the surgery room think that you're gonna look like Kim K. No scarring, no nothing. It's not working like that. One, you better have the coins that Kim K paid, and two, you need to be aware that your skin will also suffer some level of hyperpigmentation and different things of the sort. So just keep that in mind first and foremost, and second, keep in mind that you can get lipo burns and they will look a little weird on you as opposed to a woman who is of a lighter skin tone, meaning hyperpigmentation. They might be darker, you may keloid, different things like that. So you have to really think about the type of skin that you have before you make assumptions on what type of results you're going to get. Okay, so that's first thing first. Let's get that out the way. Now, we already talked about how you can get a lipo burn. Let's talk about what a lipo burn is. So if you've seen any of my videos in my playlist, then I've already shown this, but I'll probably insert something somewhere so that you guys can see what a lipo burn is. A lipo burn pretty much looks like a little black spot in an area that was treated with plastic surgery or where you had lipo or whatever the case might be, and it's super sore. It looks different from the other parts of your skin, but it's purplish, and then it turns black, and then eventually it may kind of bubble up or start to pus up, and then it turns into an open wound, basically. That's pretty much what a lipo burn looks like. It's not cute. You will notice that it's there. It won't be like, oh, I didn't even see this. You will see it and you will feel it because it will feel different, or it will be completely numb. The nerves will just kind of be out of whack. And if you've ever had lipo or you're thinking about getting lipo, the nerves in your treated area, wherever you got lipo at, will be disconnected somewhat from, you know, your whole sensory process. I'm not a scientist, but that's pretty much what it is. So they take a cannula, they put it between your flesh, your fat, and then your muscle area, and they suck all that fat out. The fat is what's keeping your skin close to your muscle, or, you know, taut to the rest of your body. So when you experience any type of trauma of that nature, your nerves and stuff have to kind of like mesh back together, and it just kind of gotta, like, you know, reconnect your whole lymphatic drainage system under there and all the rest of that stuff. So you might be numb, but that's gonna take a while for the nerves to come back to normal. However, you will notice this burn if it is there, if you do get a lipo burn. So that's the first thing. You will notice that the skin doesn't react the same to the rest of your skin, and you will realize that you have a burn, basically, in so many words. The burns can show up between, I want to say, maybe 24 hours, 24 to 48 hours, and up to like 7 days, I believe. It can pop up within that first week, basically. You'll be wearing your faja, you'll be doing different things. So sometimes it's easy to think that it's a faja burn. Faja burns and lipo burns are two different things. They're completely different, but they all are annoying and they hurt, okay? A lipo burn is going to be more of a deeper type of wound. It's gonna, your flesh is going to kind of like flake off and slough off for a while, because it's basically dead. When your skin turns black, it's dead. Every burn is going to have its own level of treatment and care, but what I can tell you that is, if you have a lipo burn and your skin starts to peel off, or you're losing skin, or you get that little yellow pussy, whatever, that's normal. That skin needs to come off because it was dead, and your body will naturally heal itself and create new skin. So that's that. If it is a faja burn, it won't be that deep. It'll be somewhat superficial, almost. And you'll have like dry, flaky skin there that's like red and breaking, and it will be a scab of sorts, but it won't be so deep where your skin is like peeling and sloughing off for months on end or weeks on end. It will be a completely different level of scarring. Let's just say that. It can leave a mark. It will not be pretty, the same as a lipo burn, but lipo burns require a little bit more care and a little bit more action in terms of the healing process. I would say, yes, you might start doing the same things for care, but it won't be the exact same. So that's the difference between a lipo burn and an actual faja burn. But a lot of people won't know that, because the time in which your lipo burn will appear will be during the same time that you be wearing your faja. So that's what makes it tricky for some people. But there is a difference, and if I can find the picture, I will put a picture of faja burn versus lipo burn over here. Now, what an actual lipo burn is, in so many words, it's an ischemia. And that basically means that there is a drop in oxygen. There is a lack of oxygen in a particular area. So the oxygen cannot carry itself to that area to treat and heal and be with that area. And basically the skin dies. Okay, obviously we have a whole system of how our body works under here, under our skin, under the layers of our skin. And so I'm not a doctor and I'm not a nurse, but I can definitely tell you from the research that I have conducted, because I had one myself, I will tell you that too much fat being removed from a place makes it hard for oxygen to be delivered there, especially if it's being squeezed very tightly. That's why they say the surgeons are giving you these lipo burns, but really it's because your surgeon is aggressive and they're getting more fat out, not because they're actually burning you. Now, technique can have a lot to do with it and how they're turning you back and forth when they're trying to get to your areas, but it also has to do with how much fat they're taking out. So some people want the most aggressive surgeon there is, and I feel that, child. Get your body snatched, but just be careful, because, you know, too much fat being removed at one time can be very, very tricky as to kind of gauge if you're going to have a lipo burn or not. So just be clear about that. Ask your surgeons, bring it up, especially if you're a woman of color. Ask them when you're in the consultation and all the rest of that good stuff, what are the likelihoods of me getting a lipo burn? What are your precautions for a lipo burn? How many lipo burns have been reported to you? If that's not something that you are willing to roll a dice on, anything is a roll of a dice. Okay, this is not foolproof, but you must ask these questions before somebody just cutting into you, okay? Because I wish I would have known, and there's not that many videos here on YouTube that go over that. So I just want to go over that with you guys right now. So bring that up. And when you're first putting on your faja and stuff, make sure that your faja is snug and it's doing its job. First of all, your faja's job in the first beginning months and weeks and days of you getting surgery is not to snatch you. Okay, a lot of people will tell you, you need this size, you need a level this and level that and stage this and stage that. That's all fine and dandy, but in the first week or two, when you are first at multiple, like at risk for multiple complications like lipo burns and faja burns and all the rest of these different infections and different things like that, when you're most susceptible to the consequences or different things that come with surgery, you want to make sure that your faja is doing its #1 medical job. And the medical job is to compress gently so that the swelling stays down and to reduce your chances of developing fibrosis. That's the first thing. Okay, you don't want to be squeezing the life out of you and furthermore, you know, putting yourself in a situation to get a lipo burn. Because I think that yes, the fat is the biggest thing. Your doctor being aggressive is really, really big, but it's also very important that you're not further squeezing the oxygen away from the area. People can get lipo burns anywhere that they've been treated with lipo, but they are very, very common on the flanks. So we know what it looks like, we know how to know that we have one, and we know what essentially it is, what the medical term is, and that's an ischemia. It's a lack of oxygen in an area. The skin gonna die, it's gonna be ugly, it's gonna turn into a wound. You're gonna have to start from jump. Your body's gonna have to repair that area. Now, those are the biggest things. Healing. Okay, let's go into that. I feel like wearing a too tight faja, I feel like added on to it. I feel like that's what made the faja burn worse than what it already was. I feel like it prolonged the healing on it. And I feel like overall, when you come out of surgery, your mind is just kind of like all over the place. One, you're drugged up most of the time. You know, you got your pain meds. And then two, you thinking, what have I done? Because you're in constant pain most of the time. And then three, you like, well, if I did all of that, I need to be snatched. But you need to let that burn heal. Take it from somebody who had to go a couple of days at a time without wearing her faja just to get air and oxygen and all the rest of that good stuff to heal my faja burn. Okay? You will be fine. As long as you're getting your aftercare the way that you need to, you're wearing your faja when you can, you're doing what the doctor's orders say, you will be fine. Okay, you will live. You will have a snatch body. You will be okay. Your body is still probably molding, like molding from surgery. I want to say from 3 weeks all the way up until like 3-4 months. Your skin is still extremely sensitive and will take the shape of your faja. And your faja will accentuate what your doctor has done for a very long time. Stop obsessing about it. Don't keep looking at it every 5 seconds. It's not going to go away immediately. Your first step to healing is contacting your doctor, your surgeon, and saying, hi, I have what I think is a lipo burn. Send a picture in or take your butt in there to go see him or her so that they can diagnose you properly and give you the steps on how you need to care for it. They might give you a cream. They might tell you that you need a skin graft. They might tell you anything depending on the severity of your lipo burn. Okay, it's a serious business. It's surgery, so you must take it serious. Don't be looping around and, you know, taking your time and not telling the doctor, because you can develop an infection. You can develop horrible scarring just because you aren't doing what you can do to make sure you get the best out of the cards you're being dealt, basically. So first things first, talk to your surgeon, ask what they would suggest, what they're prescribing you, and then follow that regimen. Watch your body, obviously. See how it's responding. Never touch the area with dirty hands. Wash your hands first. Make sure you're keeping your faja clean. Make sure you're keeping your burn covered. So you want to get sterile gauze. Even in this moment, like I said in the beginning of this video, do not be putting tapes, surgical tapes, or none of that stuff on your skin. Your skin is extremely sensitive. It might rip your skin off when you take the tape off. So you want to get gauze, just plain gauze, nothing that has an adhesive on it, anything like that. You want to just apply it with whatever ointments that have been prescribed to you or whatever you're using to apply there. I know for me personally, this is not a medical advice. okay? For me personally, I used silver. I had a cream called Silvadene, Silvadene sulfate or something like that was prescribed to me by my surgeon. I used that, and then I also used Neosporin from time to time. You also have to watch yourself with that and be careful with that, because sometimes your body can develop a rash to the Neosporin or just become resistant to the Neosporin, because they are basically topical antibiotics. So you want to watch your body with whatever you're applying there. If you see anything weird, redness, oozing, things that aren't normal for the burn, call your doctor again, child. Now here's the thing, if you go to your regular primary care, they might be like, girl, get out of here, we don't know what that is, because they're not plastic surgeons. So they might be thrown off by you bringing an abscess or a burn or an open wound to them, and you tell them that you had lipo. They might treat you a little weird or just not have any depth on how to actually treat it. I recommend going straight to your actual plastic surgeon, okay? Because also, word on the street is other plastic surgeons don't want to give patients of other plastic surgeons advice. So, you know, if anything is weird or not doing good, bother them doctors. You didn't pay them a coin, okay? They will answer your questions, and they should answer your questions. So that's that, okay? That's another thing when you're picking your surgeon. Try to ask them, so what are the protocols for people who have complications? How can I be in contact? Help nurse, post-op, all the rest of that. You want to get that information before you hop on anybody's table, okay? And that's just to be clear, okay? So those are the first steps to ensuring that you don't further complicate your complication. And then after that, give it time. Let it get air when you can. I guess when you're getting in the shower, I know how crazy it is trying to get back in that faja. It hurts. And the longer you're out of it, the more you swell up. So if you could just take a fan, a hand fan, or, you know, something where you could give it some air for a few minutes every day or every so often, or for 20 minutes every hour. I know it's a lot of work, but you want to make sure that thing heals, because the longer it's ugly, the more it can be infected, the longer it's going to be ugly, and then it's going to take a long time to heal, and you want to be cute. That's why you got the lipo to begin with. So I would suggest that. After that, after it finally heals, you want to, in the healing process, let's just go there. In the healing process, you will see it go from an open wound that might be yellow, pussy, weird, and then it goes to a completely pink area surface. It will still be an open wound, but it will be like pinky reddish. That's how you know that's the healthy skin. That's the good skin under the ear, okay? That's the good stuff. And then you will start to see the edges of your skin pull in. So the area that probably, you know, was however big is going to start shrinking slowly, and then you'll start to see it kind of raise on the side sometimes, and that skin is just going to kind of like close itself. Okay, that's what you can expect from a lipo burn. Everybody's body heals differently, and obviously it depends on your complexion as well, because then the color will start to fill in. When your skin actually closes, you will have it dark some areas, and then you'll see pink come in, and then your melanin will start to dot in. Obviously, if you've ever gotten an accident or injury when you were a child or scraped a knee, you know how the process of healing works for the most part, but that's basically what you're going to be expecting from this healing process as well. It's going to close. You're going to know that it's actually real hard skin, because you know what your skin look like even when it's damaged. And then from there, you can start applying topical ointments to help with scarring, basically. Obviously, scars are a very tricky thing. The body will do what it wants, but there are things that you can apply and things that you can do to make it easier. They have silicone patches. I really like those. They gave me just a little bit of space between the actual injury and the faja a lot of the time, and then they're not actually like sticky. They stick to you, but they not like actually adhesive, if I can describe that. So I use those. There are a lot of different companies that sell those, that carry those. Amazon is one, and I know that you can get them in Target as well. They have different name brands. I know Target has its own brand, so you can also do that as well. But the sooner you start treating it, the better your scarring will probably be. That's what everybody says, and I honestly will say that I think that if I didn't start so early, my scarring would have been worse. There is a possibility that your scar will be a little raised, and silicone does like its job. It helps it to remain flatter. not raising. I just kind of swear by them. I really like them a lot. So you can use those. Obviously you can use topical ointments like bio oil, Mederma, and different things like that. This is the process where you're focusing more so on prevention of scarring. So you don't want to put anything that's like bleaching your skin or anything on it. I wouldn't suggest that. I would wait at least 3 months to start trying to lighten the scar. I think in that moment I would be trying to put on actual medical grade topical ointments like your bio oils, your Medermas, your silicone patches, different things like that. Because even though the skin is fully healed, and please do not apply any of this stuff if it's not fully healed because you might get an infection. Even though it's fully healed, it's still very sensitive. Your skin will be raw for months. Even some days, like my skin gets raw if I don't put my Faja on. So don't expect like a turn around and you're like, oh, I feel great. No, you're going to be sore for a while. So in this period of time, just treat it with care. It's new skin. Treat it nice. Treat it like you would treat a new baby. Nicely, gently, kindly, okay? And ultimately be kind to yourself, okay? So that's pretty much the skinny on lipo burns. That's pretty much what you can expect from surgery. If you do get a lipo burn, they are not as uncommon as one would think. If you don't have that much fat, if you don't have that much to take out, I would definitely recommend choosing a surgeon that isn't that aggressive. I know we all want to get snatched, child, but you want to do it carefully, and you want to ask the questions that you need to ask so that you can be snatched and beautiful and not snatched and mad because you also burn. Because some of these burns can be huge. They can take up other places like your belly button, your sides, your back, your stomach. And what's the point of being snatched if you can't feel confident in the clothes that you want to wear or the swimsuits and bikinis that you want to wear, right? So let's just make sure we're being careful. I hope you guys were able to benefit from this video, and let me know if you guys had a lipo burn or if you guys have any specific questions in the comments. And don't forget to like and subscribe if you benefited from this video or you think you would just love it here, which I think you would. I hope to see you guys in the next one. Bye.